Good afternoon, everyone. Thank you for logging in or calling in for an important update from the department about COVID-19 and our response to it. I'm sure many of you have many questions, and I want to give you an update and reassure you that we are staying on top of all of the information available to us. I will say that as we move forward, this is a rapidly evolving situation, and so we are working on ways to ensure that information gets out to you regularly. That may be via email, it may be another video update, it might be a web page that we're working on creating that you can access for up to the minute information. This presentation is being recorded, and so if you have colleagues that were unable to call in or you want to watch a particular section of it, we'll make it available after the presentation so that you can call in. I'm going to go over a PowerPoint right now. This is information provided to us by the Department of Behavioral Health, and we've customized it with some of the information that we have. So we're going to move on to the agenda. We'll be talking about what is COVID-19. I think most people have heard a lot, and so we'll give you a little bit of information. We'll tell you what the Department of Public Health is doing, and we'll tell you what our department is doing. Going on to the third slide. I'm going to show you two slides here. There's a website, it's out of Johns Hopkins, and it has a worldwide tracking. This one was done about a week ago and shows you that at that time there were 101 cases, almost 102,000 cases, I apologize, 102,000 cases across the world and almost 3,500 deaths. This is right before I came down for this. It's now up to 137,000 cases and over 5,000 deaths. A reminder that we have flu burden every year, and to put this into perspective, every year in the United States, about 29 million people become ill with the flu, resulting in 13 million medical visits, 280,000 hospitalizations, and over 16,000 deaths. That goes up and down in different years. It can be as high as 60,000 deaths. COVID-19 is not the flu. It is a cold virus, a known virus. And so I'm going to talk a little bit about what we're doing about COVID-19. Usually it spreads from person to person, close person-to-person contact through respiratory droplets from coughing and sneezing. Can also spread through airborne transmission, where tiny droplets stay in the air even after the person leaves the area, and can only be diagnosed with a laboratory test. The symptoms are very much like the flu: a fever, a cough, shortness of breath. The vast majority of people who come down with COVID-19 will have relatively minor or moderate symptoms. They may not even know they have it. They may have a minor cold, but a certain percentage of individuals will get very sick, and some will need to be hospitalized. In California, as of March 12th, which is yesterday at 7 a.m., we had 198 positive cases and 4 deaths. 24 of those cases were from repatriation flights, 60 travel-related, 43 person-to-person, and 44 community-acquired. Community transmission is what we're most concerned about, and that is where the individual gets it in their own community, not from a known source of COVID outside of our area. There are now several counties in California with known community spread. Those include Sacramento, Riverside, Contra Costa County, Yolo, Solano, San Francisco, San Mateo, and Santa Clara. And I will go over the Fresno numbers in just a minute. Of all confirmed cases in California, the 198 confirmed cases, 4 were in the ages 0 to 17, 113 in the ages of 18 to 64, 79 over 65 years old, and 2 they didn't have that information for. There are over 11,000 individuals who are self-monitoring across 49 counties. In Fresno County, we still have only one known COVID-19 individual in our county, and they came from a cruise ship. They knew when they got off that cruise ship that they would have to self-quarantine, and they have done that since they returned home. There are around 100 people who have either been self-quarantining or quarantined on the advice of the health department. of those tested, 57 have resulted in negative tests, and 36 are awaiting test results. Even though we have no known community spread in Fresno County, other areas who are further along the path of COVID-19 have determined that by the time you know you have community spread, you've likely had it in your community for some time, days if not weeks. So we are anticipating that there will come a time that we have community spread in Fresno County. Typically, in the beginning of this type of virus, the focus is on containment, and that's where all of the known individuals with the virus are identified. They're isolated through isolation at home or in a hospital, depending on how sick they are. There's an effort made to understand where they might have traveled in the community and exposed other people to the virus, and many of the tests that have been done in Fresno County are not from that, because the one person we know simply came here from the cruise ship. Most of the tests that have been done in Fresno County are for people who are returning from areas where they might have been exposed to it. But when we're in containment mode and they're doing those types of tracing, you're really trying to identify every single person who might have been exposed to it, isolate them, and test them throughout that isolation period to ensure that they don't develop COVID symptoms. Once there's community spread, typically the efforts move from containment to what we call mitigation. And mitigation is where all of the social distancing recommendations you'll get. We recently had the governor issue a prohibition against mass events over 250 people, and recommending that elderly people not convene in groups of larger than 10, and when they do so, keep 6 feet apart. That's the social distancing piece, as well as all of the hand washing and cleaning of surfaces when individuals do have a cough come into play. So Fresno County response to date, they're coordinating closely with the Center for Disease Control and State Department of Public Health, monitoring travelers, as I mentioned earlier. There are daily calls, which we're participating in, with hospitals, medical providers, schools, airports, etc. There's also efforts with faith-based groups. We know in other countries they've had issues with church gatherings, and also participating in public education, making sure that members of our public understand what the risks are and what we're doing to mitigate those risks. We're increasing laboratory testing across the state. Initially, it was only state public health labs, and now all the commercial labs are participating in testing. You may have heard that we don't have enough test kits. There has been a shortage of test kits. I will emphasize, though, that once we go from containment to mitigation, there will be fewer testing done and more focus on the mitigation. Particularly with the mitigation, some of you may have seen across social media feeds or in the news a concept called flattening the curve. And what flattening the curve means, in the countries that have experienced the most COVID-19 cases, the period of time between the first known incidence of disease and where they're at today, there is a rapid rise in cases at some point, whether it's 2 weeks, 2 months after the first known. There tends to be a very rapid rise if mitigation activities don't happen. That rapid rise is where containment has failed. Containment has not limited spread of the disease. So then what you have to do is mitigate it. And so you'll see school closures, and you can't go to the movie theater, and sporting events have closed. All of those are to limit the pace at which the spread occurs. That pace is critically important. The quicker the rise happens in the number of cases, the bigger the strain will be on our healthcare system. We don't want that strain to happen. The slower the spread happens, the better it will be. The healthcare system will be better equipped to deal with the number of individuals needing hospitalization. So it's critically important before we have community spread that we're doing those mitigation activities. That's why you're hearing about school closures in Fresno before we've had community spread or evidence of community spread. And that's why you'll hear about some of the things that we'll be doing. This slide shows you the new state guidelines for mass gatherings, and basically These are based on the status of community spread. We know that we've determined in California that we are not having gatherings over 250. In our department and in the county, we're really trying to limit even beyond that. We're looking at all of our meeting schedules, and anywhere there's a meeting that we can conduct it via telephone or web-based, like what we're doing today, that's the way we're going to conduct those meetings. We will be no longer traveling out of the county for county business to trainings or seminars or conferences for at least the next 2 weeks and beyond, depending on how the spread happens in our area. You'll see the next slide shows some examples of specimen collection. Right now, we have a variety of ways that when people are being tested, we're trying to keep that process safe. And so right now, what's being recommended by the Public Health Department is if you're sick, that you do not go to the emergency department, that you manage your sickness at home. There is no known treatment right now for the virus, and for most people, as I said earlier, they will experience mild to moderate symptoms. At such time as you become further ill, you should contact the EMS and go to a hospital. But in the beginning, we want people to take care of themselves at home because the vast majority of people will be able to. But when the testing is done, for instance, the individual that came off the cruise ship, it was done, they drove up in their car, the medical staff went out to the car, did the swabs at the car, then the person drove back home. So they were never in the healthcare facility. So what are we doing? What we've been doing the last several days is reviewing what we call our continuity of operations plans, and that means identifying critical services we provide that need to be provided even if we're in significant mitigation strategies. And for those of you who are clinical in nature, those are things like individuals who are on Clozaril. And in a minute, I'm going to have Susan talk specifically about what some of those activities might be. We're updating our internal communication protocols. That's where you might see an internal web page where you could go to get up-to-date information, and doing this web presentation today. We're also making sure that all of our public areas are on an enhanced cleaning schedule, making sure that surfaces are wiped down, etc. Signage has went up in bathrooms and entrances and such, reminding people about safe hygiene practices. We'll be looking at some other strategies. You should practice these strategies at home and in the community as well. And I know that information has been shared. I really want to give significant kudos to our leadership team. Everyone is really, really coming together and working hard to do all of the things that I've been discussing and make sure that we're keeping both this place safe for all of you as well as for the people that we serve. We are encouraging blood donations if you're not sick. Typically what they're finding in areas where the virus has spread, the blood supply is dwindling, and oftentimes it's needed, and so please give blood if you can. I'm going to turn it over to Susan for a minute, who's going to talk to you about some strategies that we're developing to limit in-person treatment.
Good afternoon. So as Dewan mentioned, I'm going to focus on what we're doing on care delivery, and we are transitioning to limitation of in-person services for only services that we're determining to be critical or essential, such as crisis services when someone is unable to remain stable in the community or in their home, as well as Dewan mentioned, Clozaril injections and other critical medical services. I want to emphasize that more communication will be coming on the things I'm about to speak about today, and you should continue to work very closely with supervisors and managers on everything that we're talking about today. So supervisors will be working with all of our program staff to provide a script to begin calling the people we serve to explain to them that in an abundance of caution and to limit the potential spread of COVID-19, we are going to conduct our services by telephone and, where possible, video conferencing. Our IT team is working on getting out instructions on teleconferencing, as we speak. So more information to follow on that. And as I mentioned, this information that you'll be receiving if you're a service delivery staff or a person who will be supporting service delivery will provide detailed information, including the things that you should say. We are also going to be sending out this afternoon email instructions on how to manage in-person services that must occur. This will include the delivery of crisis services, essential medical services, as well as how we will handle people who show up to our clinics unexpectedly or in crisis, or because they didn't yet get communication from us that they should have their services by phone. Those instructions will include such things as a screening, and again, we'll be providing a script for that, as well as the social distancing protocols. We're working also to deploy to all of you print materials so that the people who come to our clinic can walk away with detailed instructions and posting for our buildings. I want to assure you that we're working very closely with our 24/7 care facilities. All of the people we serve are at various levels of their recovery. So it's very essential that we make sure that our communication to them in telephone is calm and reassuring, and that we're making sure to meet their needs. This includes those who are in an acute care setting, and we've been in daily contact starting yesterday, and we'll be in daily contact with our crisis facility and our acute inpatient facilities. Lastly, I want to also share with you that we will be sending out information on how to manage stress, including crisis stress management. This information should be shared with the people we serve in our routine telephone service delivery in the coming weeks, and we should also utilize these strategies ourselves. As DeJuan said, this is a rapidly evolving situation. Things like this can be stressful, and we want to assure you that your wellness and the wellness of the people we serve remains our top priority.
And all of these resources and guidelines and strategies will be shared with all of our contracted providers. We want a consistent approach for all of the people we serve and all of the individuals serving them. It's very important we keep everyone as safe as possible. There is no reason to panic. In fact, what we're doing is proactive and helping to reduce the type of situation that typically people fear. And so I want to reassure you that we're doing everything in our power to do that. I have on this slide just the general guidelines of how to protect your health and those around you. Washing your hands with soap and water. We've heard you got to sing happy birthday while you're doing it, and that will help you do it for a long enough period of time. You might even sing happy birthday twice. And we won't laugh at you if we hear you. Avoid touching your eyes, nose, and mouth with unwashed hands. That is typically how the virus enters your system. It does not enter through your skin. It enters through your mouth or some sort of mucus opening. Avoid close contact with anyone who is sick, and always to reduce the risk of infection, and that's really the case for all viruses. Stay away from work, school, or other people if you become sick. I'm going to be sharing with you in a minute the Human Resources webpage where you can go to with some guidance on what to do if you're sick and what to do if you have a family member sick and how leave and such will be managed. If you've been sick or have a family member who's been sick, please consult with your doctor, get a note prior to returning to work, and if you're in doubt, call your supervisor. We have had some guidance that if people think they have COVID-19 because they have been to one of those areas where they have it, or because they've had contact with a known person with COVID-19, then we are asking you to call the Department of Public Health. But if that's not the case, then please call your supervisor and they can help guide you as to what to do. This is the page for you to go to on the Human Resources. It's on e-services, and it has a number of guidelines and information about how leave will be handled. Again, if you have any questions, our Human Resource Department is well aware of all of these guidelines and can assist you in planning strategy. We likely we'll get to a situation where schools close, and so that may be one of the issues that you have questions about. How will I handle that? What will I do with the kids? We are exploring telework or alternative work schedule options for employees who do stay home or who need to stay home for parts of the day, and we will share those with you as we have them. I'm also in this slide are resources for our Fresno County Department of Public Health's website. And when this slide goes out, you can click on that and it'll take you right there, as well as the state's website, some federal information from the Center for Disease Control and the World Health Organization. This is the Center for Disease Control's website is the next slide and is pretty much the last slide. Now, I will tell you that you're all on mute. That's the way this works, but you do have the capability to ask a question through the application if you logged in. If you called in, unfortunately, I don't think we have a way to do that, but you could email me and Tina Young your question, and we will get it answered to the best of our ability. So I'm going to take a minute and see what questions you guys have through the application, and we will do our best to answer them. There's a little bit of a technical delay here where we're giving you the access to do that.
We're muted right now. They have access. Nobody sent anything yet. So
Okay.
we had one person at the beginning said they have no. Will group services be canceled?
Okay. Question rose, will group services be canceled? Yes, group services will be canceled. We're also advising locations like Blue Sky, where a lot of people gather together, to limit or eliminate that activity right now.
Is a doctor's note required to return back to work?
This is a rapidly evolving situation, and right now you will not find on the HR website that a doctor's note is required, but I would ask you to contact your supervisor when you're returning to work so that we can use the up-to-the-minute guidance that we're getting on what would be required. Remember, what we're trying to do is keep everyone safe. So right now, today, I will say that a doctor's note is not required, but you do have to call your supervisor and describe to them the circumstances of why you've been off work so that we can determine whether it's safe for you to return to work.
Lots of questions all about how paid time off and coding and all of those
Yeah.
things.
So the questions on paid time off and coding, most of those, if not all of those, are answered on the Human Resources website. And I'm going to pull it up and tell you a little bit of I might not be able to pull it up. Oh, it is. It's allowing me to pull it up. Excellent. Okay. So I'm going to just go over these quickly to give you an idea of what information is available to you that could assist you in understanding these. There's information on there on employee leave, and I'm gonna just tell you what's on this website very quickly. It's telling you that if you have the same symptoms as COVID-19, remember that's the fever, the cough, etc., stay home. It will tell you that if you think it is due to COVID-19, then you need to contact the Department of Public Health and possibly do a 14-day quarantine. We will be relaxing a temporary suspension of the disciplinary provisions of it in our attendance policies. So for unexcused absences, and initially that suspension of disciplinary action will be for 30 calendar days. And that could be increased depending on how long we're going through this. We will be looking at telework and alternative work schedules, as I mentioned. If you are subject to a quarantine because you have known COVID-19 or you have been to an area prior to March 12th, then you will get administrative time off, and where appropriate, telework will be considered. If you choose to travel out of the United States after yesterday, so from today forward, and you become subject to a quarantine, you will not be provided with administrative time off. Generally, I would say there should not be international travel right now. If you do so, it's on your own. If you become ill during quarantine or self-monitoring as instructed by the Department of Public Health, and you develop COVID-19 beyond those 14 days, you can use annual leave or any leave balance that's available. If you're caring for a sick family member or members who have tested positive, you can use annual leave. And you can also access Family Medical Leave, FMLA, or California Family Rights Act. You can work with Human Resources to determine if you meet eligibility. If you're impacted by school closures, then we understand that could affect work schedules and increase absenteeism. So we'll be looking again at telehealth or telework and flexible work schedules, but you can of course use your annual leave for that. We are concerned about the higher risk populations, older adults, and individuals who have serious chronic medical conditions. Please talk to your supervisor if you feel you meet that category, and we will work with you on how we're going to handle that. As far as supervisors who are concerned about codes and such, we'll be sending out specific detailed information on what codes to use for different things. Apparently there's a vendor on the line who's asking about face-to-face visits. Again, I will say that all of our contracted providers will be receiving the specific guidelines that we intend to use. They are not currently being used, but that we're going to use, and we recommend that our contracted providers also use. So please know that, again, rapidly evolving situation. I know it's hard to be patient. It feels scary right now, but we're going to give you as much information as we can. We think if you're armed with information, there's really less reason to be scared. We've been in contact, as Susan said, regularly with our 24/7 providers, and we've also sent information to all of our contracted providers, advising them where we're at up to this date, and as we work on these other guidelines for alternative strategies to face-to-face interactions with clients, we'll be sharing those with our contracted providers. All right, next question. Who is responsible for cleaning? Our housekeeping staff has been instructed on how to do the cleaning that's being recommended at a minimum. None of you should be worried about doing additional cleaning. It doesn't take strong disinfectants or such to clean. So if you want to use your own, if you have the Clorox wipes or what have you, I highly encourage you to feel comfortable using those. But there are staff who are responsible for that cleaning. If you feel that it's not happening in your area, please talk to your supervisor and we will address that. Questions are coming in fast and furious. Okay. Explain procedures on managing symptoms. So generally speaking, the symptoms that you're going to get, as I mentioned, are very similar to flu, cold, fever, cough, etc. And so the advice being given to us by the Center for Disease Control is you should manage them at home as you would any other illness. If your fever persists, if you begin feeling more uncomfortable, of course, at any time, contact your doctor and present to an emergency department. The reason we're telling you to manage your symptoms at home is that that is another strategy for reducing the rapid spread of community transmission. And the vast majority of people, well over 80%, will not have significant symptoms. And so most people should be able to manage at home. If you're scared, if you are uncertain, contact your doctor or present to an emergency department. We are not telling you can't go to the emergency department. We're advising against it simply as a mitigation strategy. Next question is transportation requests already approved. How will they be handled? I'm not sure what is meant by this question. If the person who asked this question could clarify what they mean.
It's regarding transports.
Oh, transports?
Already approved requests for out-of-county transports, will they be affected?
At this time, we're going to manage those on a case-by-case basis. Likely, we will be reluctant to transport people between counties where there has been community spread. But again, we'll have to take it on a case-by-case basis, and we might take, I really want to convey, if we don't know the answer, it's not because we won't know the answer, but as this situation rapidly evolves, we will develop answers for each of these questions. So for transportation requests, we are developing those protocols right now.
Where are testing sites?
Currently, to get tested, your doctor is able to administer a test. Your doctor may or may not have a test kit, so that would be one where I would contact a physician before I presented. The Department of Public Health has test kits and is doing testing now. However, please be aware, because of the number of test kits, if you call and say you're sick and there's no reason to believe you have COVID-19 because you have not returned from a high-risk area or been exposed to a known person, you will likely not get tested. Depending on the circumstances, you may be asked to self-quarantine. And so it's, again, on a case-by-case basis. I will say that, again, once we move from containment to mitigation, right now we're in containment in Fresno County. If we move to mitigation strategies as a broad public health strategy, then testing will likely not be done at all or much less frequently, because the focus shifts from isolating people with known COVID to preventing broad transmission of COVID across our community. If someone is saying that they don't believe the area they work in is being cleaned appropriately, you should talk to your supervisor. If you talk to your supervisor and you don't feel you're getting a satisfactory answer, please take it up the chain of command. Everyone is working very hard. We want you to be protected. If you don't feel that your area is being cleaned appropriately, please go up the chain of command to get that addressed.
Are we expecting court calendars to be impacted?
The question was, are we expecting court calendars to be impacted? Yes, I would anticipate that all normal activities in some way, shape, or form will be impacted. The coming days will be really, again, rapidly evolving, depending on when we have evidence of community spread. We've had Fresno State closed. Today, Fresno City College announced that it's going to online classes. We've had some smaller school districts in our county close, and I would anticipate that will continue. Los Angeles County School District is closing, as is San Diego County. So the news is certainly a source for you to understand what's happening. I would not panic about those closures. Those are mitigation strategies. Those are strategies to reduce the interactions we have with one another that could cause more rapid community spread. It's a sign that we're doing the right things to try and limit the pace of community spread. So those are the kinds of things that you should feel good about. What do supervisors do when staff are quarantined? We do not have any staff quarantined right now. I want to reassure you of that. If we stay in containment stage and we determine that one of our staff has COVID-19, while we're in containment stage, there would be an attempt to what we do, it's called tracing, to determine who might have come in contact with that person. And if others came in contact with that person, first of all, that person would be tested and ensured that they did have COVID-19 and not the normal flu or a cold. If it was found that someone did have COVID-19, we would attempt to identify anyone who had come in contact with that person, and they might be subject to quarantine as well. But what your supervisor would do if an employee was quarantined and all of those other activities were happening with public health, they would be the ones doing that. We would simply work with the employee to determine how long they would be home. If their job was conducive to telework, we might offer them that opportunity, but they would work with the individual on ensuring that their leave was handled appropriately.
Okay, so I gotta mute it again. What is needed to justify medical need for So like, how are they determining which patients they're gonna see and which ones
Okay.
they're not?
The question that was raised is, how is it determined who gets seen via telehealth or in person versus who doesn't? Every client, there will be an attempt made to be seen by telehealth, I believe. The prioritization, if you will, or the risk stratification is being developed right now by our clinical staff. So what we would look at are any individual that would be considered psychiatrically at risk. So recent hospitalizations, that type of thing. The team is going to be reviewing all the cases and making decisions about who needs to be seen in person and who could be seen by telehealth. That will be an evolving situation as well. We might have someone that we're attempting to see via telehealth who we escalate up because the need seems to be increasing. But again, those are protocols that we're finalizing today and hope to get out shortly.
What about field case managers? Business as usual?
Right now, with our field case managers, we'll be working into the protocol development. What we will do, we are not anticipating that it would be outside of the protocol I've already discussed.
Would the county ask staff to work in other areas such as RNs?
The question was, would the county ask staff to work in other areas? So there are a number of things being discussed when we talk about telework or alternative work schedules. We know that there is a 24/7 hotline that public health has developed. So if we had staff, for instance, that were working from home and we could use them to answer those phone lines, it is certainly possible in a disaster scenario that nursing staff could be asked to work in a local hospital. That would come at the direction of the Public Health Crisis Center. And as we know more about that, we will certainly share it with you. I will tell you, I've attended those meetings the last few days, and we are having many, many proactive conversations about what we would do given different scenarios. And so there is work being done to prepare for that. All right, the next question, what if I commute from a county that is in mitigation? What do I do about work? If you have any questions about, right now, I don't believe any of our staff could possibly live in a county that has community spread. I shared those counties earlier. That will likely evolve, and we'll have to address that as it occurs. And again, if there's any questions, please talk to your supervisor and we will get an answer for you.
When should we be anticipating a script coming out for staff to call clients?
The question was about when would the script come out. I believe that script will come out today, Monday at the latest, I would say. So look forward to seeing that. What is needed from an employee that requires to telework? Right now, the county for the last several days has been analyzing our capacity for the number of individuals that can VPN into our system. There was a question about if an employee has the ability at home to VPN in, will that be allowed? And we're fortunate to have someone from ITSD here with us, and that is being looked at right now. I will say that typically for firewall issues, VPN is the safest way for people to enter the existing county resources, we'll say. I know that ITSD is looking for alternative ways to do that, where some information or places that you would do your work could be available outside of the VPN process, but that is not decided yet. Did I answer that right? Sort of.
Close enough. It's really, ITSD will be coming out with more information for departments and users.
Okay. The information I'm being given is that ITSD will be coming out with more information for department and users, so look forward to that.
Has there been any research regarding pregnancy effects? Staff is pregnant and works out in the field.
The question was about pregnancy effects. I have not heard an answer to that question. So what I would recommend is that if you contact your supervisor, we will get you connected with public health who could answer that question.
Do you foresee a shutdown for DBH?
The question was, do I foresee a shutdown for DBH? It is our expectation that we will develop strategies that will enable us as much as possible to maintain functioning for our highest priority clients. We are doing everything within our power to proactively set things in motion that will enable that to occur. I cannot guarantee that we wouldn't get to a time where that was difficult to do, but we will stay in communication with you. We are not there today. There is no reason to think that we will get there tomorrow, but we will communicate with you daily to keep you up to date on where we're at and what we think we need to do next to prepare for this. All right, we don't have any more questions right now. I am 100% confident that there will be questions as we move forward. And so again, we will develop regular ways of communicating with you. It's possible we'll do something like this every day, but we will certainly have a place where you can get up-to-date information. If you have a question that you think of after this, please feel free to contact me or Tina Young, and we will get your question answered. That will always be available. And I look forward to continuing to communicate with you as we move forward during this difficult time. Thank you.